Dr. Martha Whyte, Office of Public Health, Region 7 Director. Okay, muscle aches can be caused by COVID. Torn cartilage, can that be caused by COVID?
No, ma'am.
It can't be. Can it be?
No, ma'am. I'm sorry. I can't blame that one on COVID.
Can it be caused by getting coffee?
Because I tripping while you go to get some coffee.
Okay. All right. I'm glad I didn't. My first MRI yesterday, by the way, I almost had a panic attack, but I made it through. So a medical win for me this morning. Oh,
They can be a little scary. I agree.
they really are. Dr. Martha Whyte, I want to make sure we didn't give any misinformation out with regard to the plan for vaccines. I want you to clear up when they're arriving and who's first in line. The governor has actually said we could actually see some shots this weekend, as early as late this weekend. They're on the way, huh?
They're on the way. They absolutely are. They received their emergencies authorization yesterday, and Moderna will come up for theirs next Thursday, which we foresee they'll receive. We've already received the syringes and diluent and stuff that goes along with it. They kind of send you a kit, so we're just waiting on the vaccine, and that could come any day. We will probably get a little bit this weekend, but the big allotment probably will be early this week coming up,
Okay.
like Monday.
If we put information out that indicated you weren't clear on the plan, that's absolutely false, and I want to clear that up. If we did that, I apologize for that. The plan is who's first in line. Tell us about that.
So the first group, this first Pfizer group, will go to the hospitals, primarily because it's difficult to deal with the temperature range and the way we were able to receive doses. That first Pfizer group will go to hospital healthcare workers, frontline, and of course that's their COVID workers, not every hospital worker. And then the next group that's coming in quickly behind it will go to EMS and long-term care facilities, which is like nursing homes, your skilled care nursing facilities, things like that.
Will that be the Pfizer as well?
It will be probably some Pfizer and mainly Moderna.
Answer that question for me then. If it's the Pfizer, which has to be kept at that temperature, how do you get it out to remote locations like to nursing homes? Is it dry ice? Is that the answer? I mean,
for nursing homes, it will not be that, but they do have it comes shipped in a container that keeps it at that level, as long as you keep it in that container.
Okay.
And then once you break it down, yes, you have to use pelleted dry ice.
Okay. And after we get through that group, is there another group between them and the general public that's going to be in line next?
So there will be another group, and who exactly is included in that group? The American Congress on Immunization Practices, big fancy name called ACIP. They're the ones that will finalize who's in that group on the federal level. We have an idea like law enforcement, teachers, that kind of group, but and then of course high risk. Then they're also looking at like jailers.
Okay.
A lot of people have been upset about inmates. It's more the people working in jails that they're talking about when you see that written. But that's not been set in stone yet, so it's not been released exactly who will be in that next 1B group.
Will the vaccine be mandatory for anyone? I guess the employer could make it mandatory for healthcare workers, but in terms of the government saying you must have this vaccine, that's not in place, correct?
It's not in place right now, and there's been no talk of putting that in place. Now, we know in order to really get through this pandemic, we need about 75% of us with immunity to it. So right now we're at about 20%, 25%, even with all these cases that we have. So we need a lot of people to take this vaccine. We need people to have, to hopefully seeing people get it, seeing our healthcare workers, our frontline workers receive it and do fine. Also realize 44,000 people have been in the Pfizer trials around the country and around the world. So that's a lot of people who've already received it that have done well, and that have helped it pass its safety requirements. So I hope that we can encourage people that it's safe and it's valuable and it will help not just themselves but this whole country move forward.
To those who say that you're giving me a dose of COVID in this vaccine, we hear people say that about the flu vaccine. Can you explain that to them?
Yes, ma'am. So there's no live virus in this vaccine. It's just pieces of protein that are similar to the virus that will cause you to have an immune response. So what they use is part of the virus that will cause an immune response. That's what's in the vaccine. There's nothing in it that will actually make you sick. You've heard stories that people have had high fevers. There are some cases less than 10%, more down around 2 to 5%. So when you think of the thousands of people who have gotten it, it's not very many, who have had flu-like symptoms for 1 day, fever, muscle aches, and some people get that with the flu too. And that's actually people who have really strong immune systems that are responding strongly to the vaccine. Body's doing what it's supposed to do. Okay. You're not getting sick. Your body's responding as if you were getting sick and making those antibodies. That's what you want it to do. Some of us feel that, some of us don't.
Okay. Doc, we're talking to Dr. Martha Whyte. Let me ask you this. Everyone wants to know, when is it available? You told us earlier that it was going to be available probably in the first quarter to the general public. Where will it be available? Will I go to my primary care? Will I go to quick cares? What's the plan with regard to the general public? When and where do I go to get it?
So right now, they've not determined whether we are going to do what we call pods, which is where we open a site and you come to a large sites and that's where you'll get vaccinated. Eventually, Aaron, it's going to be everywhere. Once we get enough vaccine out there, all these 6 are approved and there's vaccine everywhere, you'll be able to go to your private provider. We are working closely with pharmacies. The federal government has made agreements with Walgreens and CVS to help us vaccinate our nursing homes already. So I think that that's another trend that we'll see as we go into the general public. But right now, it's come so fast and so quick. It seems slow to y'all, but once it started moving, just remember they put out their efficacy, and then the next thing you know, they're going to go for the EUA, and now here it is, it's coming, right? So it's moved really quickly into states. So we're going step by step, and as we get more information, then we'll be sure to get it out to you. So you'll know where to get it. It probably won't be at your private provider right away, but we'll tell you where it is.
And it's 2 shots. You get one now, and then when's the second one?
They're 2. Depends on the vaccine. You have to get the same vaccine you got the first shot with the first shot. So if you got Pfizer, you'll get Pfizer. If you get Moderna, you'll get Moderna. And they're about 25 to 30 days, depends on the vaccine. Okay. So a month. And then Johnson & Johnson, the one that's kind of tailing end coming behind, is a 1-shot vaccine.
Great information. Dr. Martha Whyte, thank you so much for your time this morning. You sure about that cartilage tear and COVID not related?
I'm sorry, babe. Can't blame that one on COVID.